On Call After Hours, where we answer the questions we weren't able to get to during the broadcast portion of our show. All of your questions are important to us, and we want to answer as many as we can for you. So let's just dive right in. From Sioux Falls, 4 years ago, endometrial cancer, had hysterectomy with ovaries removed. Do I still need to get pap smears?
For 1 more year. So usually we follow with PAPs of the vaginal cuff, kind of like we talked about, for 5 years after a cancer has been diagnosed.
So if it was a cancer, then you would do every year for 5 more years or 1 more year?
You actually do them usually every 3 months for the first 2 years, and then after that every year for 3 more years to make it 5. So see your GYN oncologist or whoever did your hysterectomy for 1 more PAP, if it was 4 years ago.
If it was 4 years ago?
Yeah.
That's it?
Right.
So 4 more. Watertown, 76-year-old person, 4'10", and she said caller had a fistula between the bladder and the bowel. What is that, and what do you do for it?
So a fistula is kind of an abnormal connection from one area to another. So in this case,
Pipe.
it happened to be, in this case, it happened to be between the bladder and the bowel. So can be caused by a number of different things, but in the end, it still needs to be fixed or resolved.
Or otherwise, you keep getting fecal material in the bladder,
Correct.
and it's recurrent infection.
Correct, and that sets you up
That's a
for a
bad
whole
thing.
host of problems. So for that type of thing, I would probably recommend having them seen by, I would probably say a urogynecologist, because that's going to be the type of person
Or a
that's going to
general.
be,
A general
General
surgeon
surgeon.
or a colorectal surgeon.
Yep. Yep.
But you need to close that pipe off.
Exactly.
But the question is, why do they occur, though? What's the most common reason?
Well, it can be bowel related, so Crohn's disease, ulcerative colitis. It can be previous surgeries, so just scar tissue from a previous surgery. We see mesh that
Mesh
has
is-
in the past
that's the
that has
risk.
caused.
The sling procedure doesn't do that much, though.
No. Things that cause inflammation and kind of cause continued irritation of that area.
And then a tube between the colon and the bladder can occur, and then your bladder is always infected.
Yep.
Okay, please discuss Premarin, when to take or not. Is it necessary to have a pap smear after hysterectomy with 1 or no ovaries, and why? So we did talk about Premarin.
Yep.
Bottom line on Premarin, it's not always a bad thing. There's a risk to it, but
Correct.
Yep. Yep. It's kind of one of those things that needs to be individualized to the patient.
right. And necessary to have a pap smear after hysterectomy with 1 or no ovaries. If there was no cancer, no.
No cancer, no.
Regardless of what's going on with ovaries.
Right. Has nothing to do with the
Yep,
ovaries.
exactly.
Had a hysterectomy due to misfiring endocrine gland of the uterus. Why does this happen? What is a misfiring of the endocrine gland? Had a hysterectomy because the uterus was misfiring, probably bleeding.
Could be.
Could be bleeding, could be like some people get this pelvic congestion syndrome where they have increased congestion of the vasculature and nerves in the pelvis. So I'm not exactly sure, what this person means by the misfiring, but
What about fibroids? Fibroids we call in Atlanta, and I'm not making fun. They used to call them fireballs of the uterus. I can remember actually hearing a lady say, "I had fireballs." But what are fibroids, and do you need to do a hysterectomy for that?
So fibroids are usually just a enlarging or an abnormal collection of some of the smooth muscle tissue.
But not cancer.
Not cancer, although there's I would say, a minimal risk for the potential of it. But in the average patient who has had fibroids that have stayed the same size for years, I would say very minimal risk. As long as they're not causing them symptoms, they don't need to do anything with them.
Sometimes they get big enough they can cause it.
right. And about 70% of women actually have fibroids, so they're very, very common.
Yep.
It's just like Dr. Bennett said, if they cause symptoms, if you're having heavy bleeding, pelvic pain, pressure type symptoms, because they can get very large, then that's a reason to have them removed. Otherwise, you can control heavy bleeding with medical options too. So,
Yep, a number of other things.
and they tend to shrink when you go through menopause. They don't always go away, but they aren't a problem anymore usually.
Britain, 50-year-old, regarding mammograms, she's been advised to get an expensive ultrasound test, but can't afford it and was wondering how important it is.
I would say some of that is kind of going to be dependent upon what the reason was for the recommendation for the ultrasound. If it's a situation where they're wanting to evaluate some sort of abnormality on a mammogram further, then I would say it's a good test to have done because it can help either rule in or rule out an abnormality.
A lot of times in young women who have symptoms, so breast pain or they feel something, we do recommend an ultrasound because it can give us more information on, does this look cystic, so fluid filled, or does it look cancerous? And that's where the ultrasound can help determine that.
Vermillion wondering if the docs could discuss tesserae. It must be a pessary, as an alternative surgery for vaginal prolapse, or doctors seem to be pushing surgery. What about a pessary?
And we had kind of talked about that a little bit, yep. There are a number of different shapes and sizes of pessaries.
What would be a shape? Would it be a ring that you would just push into the vagina, it would hold things up there, or what?
There are ones that are just shaped like a ring. There are ones that are ring-shaped and have what we call kind of a support mechanism in between. So in between the actual ring, there's a little bit of material. There are ones that are shaped more like a donut. There are ones that are shaped like a cube. There are Gellhorn pessaries that are almost kind of like a little flat disc with a little bit of almost like a handle on the end. There's a lot of different shapes.
And pessaries aren't just for prolapse. We have pessaries actually for the stress incontinence that we talked about on the show, where the urethra, that tube that empties the bladder, moves easily. There are pessaries actually that have extra support that you place right under the urethra inside the vagina to help avoid surgery for the stress incontinence too. So
Sometimes for patients that just have problems when they're exercising or when they're doing a certain activity, they can use something like a pessary
Put the pessary in before the
Yep.
exercise.
Yep, and then take it out when they're done.
Yep, and many women do very well with pessaries. There are a lot of more active, younger women who prefer a surgical route because with a pessary you do have to put it in and take it out. You leave it in too long and sometimes you can get infections or you can get ulcers in the vagina. So that's the other thing to think about with pessaries.
Yep.
Please discuss Botox procedure to treat incontinence. Why, when, how? And this is in a 62-year-old person whose 90-year-old mother is considering this procedure.
Okay, this is
That's it.
Yeah, great question for Dr. Barker. But the way Botox works is it basically acts as it's a relaxer, right. I don't want to say toxin, but it's a relaxer of the muscle. And so if you have an overactive bladder, I think what Dr. Barker was alluding to is that you can use this to help relax that muscle so that you don't have to use the oral medications that maybe cause
Really
side effects.
Dryness mouth and dryness eye. I wonder if it's kind of spendy though.
Yeah,
but if it works,
right,
it's what
right.
a great deal.
Yep.
Caller has low bladder tone. She has to push in on her abdomen to urinate. If she tries to hold the urine, she's incontinent. What can she do?
So for some, I would say this type of patient, if she's aware that she has kind of an abnormal bladder tone, doing something like timed voiding. So if she's aware that she can hold her urine for a certain amount of time without having problems, then I would say if that happens to be, she can go for 2.5 hours, then maybe at 2 hours, she should try to make a stop in the restroom just to avoid having accidents for those types of things.
Good answer. Polycystic ovarian syndrome, was wondering if the docs could discuss this. Her daughter has it and she's developed a beard. Okay, let's talk about polycystic ovary.
So it's very common, polycystic ovarian syndrome.
Like
It's a,
one in
Oh,
I would
100?
say it's
I would say it's more common than that.
15, 20%. You think it's,
Whoa.
and it goes along oftentimes with obesity. So, I mean, it's a metabolic syndrome. It can be familial. So that you're at increased risk for developing diabetes, high cholesterol. And usually you have signs of what we call hyperandrogenism, so higher levels of the male hormones that we as women all make, but those levels are higher, and so you can develop dark coarse hair that grows on your chin or chest. You can develop more acne. Some people have thinning of the hair associated with polycystic ovarian syndrome.
You get mean and aggressive. Just a joke. Just a joke. I'm
going to
just
stay
kidding.
out of that one.
You can have irregular cycles, so irregular periods with polycystic ovarian syndrome. And truly, not everybody who has polycystic ovarian syndrome is overweight, but the majority are. There are what we call thin or non-classical polycystic ovarian syndrome patients too.
And you can treat it with metformin, a diabetic pill. No?
For insulin insensitivity or glucose intolerance,
Yep.
yes, we can use metformin.
But that makes them fertile.
Correct. It can help with their cycles. So there's a whole
Story
lot of
there.
avenues with PCOS.
We could spend another hour on
Yep,
that.
depends on the age of the patient and what their goals are. Do they want pregnancy? Do they not want pregnancy? So birth control pills oftentimes are what we use as a first line.
That's usually
So
what my primary recommendation is for patients as well.
they actually increase the binding of your free male hormones, and so that can help with the hair growth, the acne, those sorts of things, and of course regulate your cycles, which is important too.
But as far as the actual hair growth portion of things, there's not any medication that we can give patients that makes things go backwards in time. So you can't give a medication that's going to magically make the hair go away. We usually say the only permanent hair removal solution is going to be actual physical removal of the hair, those types of things.
There are some ways where people can take out the
Yeah,
hair,
so
hair
there-
follicle. Or something.
Right, and there are medicines that can help to sort of decrease that hair growth. There's laser treatments
Yep.
now that help to get rid of the hair growth. There's all sorts of things that.
Okay.
But what our goal in treatment would be for trying to take care of the PCOS would be to try to prevent the further progression of some of those types of things.
Okay. Any take-home final messages that you'd like to make?
I would just say make sure that you come in to have your annual Well Woman exams. There's a lot of different things that can go on in the lifestyle of women, and make sure that we're evaluating and getting a chance to treat all of those that we need to.
I concur.
Okay. And I would say if you're pregnant or possibly pregnant, that's in particular, we need to make sure that you're seeing somebody for your health care. Make sure that works out so your baby is fine.
Exactly. Baby and mom both.
Well, thank you both for doing this. And it's hard to put a person on the line and face those darn cameras, but we appreciate you so much. Thank you, and thank you for joining us on our website. We appreciate all of your questions and the opportunity to answer them. And until next time, stay healthy out there, people.